A 29-year-old woman comes to the office due to worsening pain in her right knee. The patient has had increasing knee pain and swelling for the last 3 months, which has prevented her from going to her weekly yoga class and running on the weekends. She has tried taking ibuprofen and putting ice on her knee, but these interventions have provided little relief. The patient has no chronic medical conditions and does not use tobacco, alcohol, or illicit drugs. Temperature is 37.2 degrees Celsius. On examination, the right knee has mild soft tissue swelling with no effusion but with decreased range of motion. X-ray shows an expansal lytic lesion at the epiphysis of the distal femur, as shown in the exhibit. Complete blood count and serum chemistries are normal. The question is, which of the following is the most likely diagnosis in this patient? The choices are Choice A, Baker cyst. Choice B, giant cell tumor. Choice C, Osgood-Schlatter disease. Choice D, osteitis fibrosa cystica. Choice E, osteoarthritis. Choice F, osteoid osteoma. If you know the answer, click the like button. If you're an average person, keep watching. The correct choice is B, which is giant cell tumor. This patient has progressive knee pain with a lytic bone lesion consistent with giant cell tumor of bone. Giant cell tumor of bone is a benign but locally destructive neoplasm that is most common at the epiphysis of long bones. The incidence is highest in young adults who have reached skeletal maturity, but it can also occur in older adults, typically associated with Paget disease of bone. The course is variable. Most patients have only local manifestations, example pain, swelling, stiffness, and pathologic fracture, but pulmonary metastasis and malignant transformation may occur. X-ray in giant cell tumor of bone characteristically shows an eccentric lytic lesion, which is often described as resembling soap bubbles. CT imaging can show greater detail of the mass, and MRI is often indicated to visualize the adjacent soft tissues. The diagnosis is confirmed with biopsy, which shows multinucleated giant cells resembling osteoclasts interspersed with sheets of mononuclear stromal cells. Surgery, example intralesional curettage or excision, is first-line treatment. Monoclonal antibodies, example denosumab, against the receptor activator of nuclear factor kappa B ligand, which is overexpressed in the stromal cells, can also be used to shrink the tumors. Let me explain why the other choices are incorrect. Choice A and E, Baker, or popliteal, cyst is caused by extrusion of fluid from the knee joint into the semimembranosus or gastrocnemius bursa. It is typically seen in patients with underlying knee disorders, example osteoarthritis, and presents as an asymptomatic bulge in the popliteal fossa or with pain and swelling in the posterior calf. X-ray findings in osteoarthritis include joint space narrowing, subchondral sclerosis, and osteophyte formation, but the epiphyseal bone is normal. This young patient with no history of joint disease is unlikely to have osteoarthritis or a Baker cyst. Choice C. Tibial tubercle apophysitis, also known as Osgood-Schlatter disease, causes pain at the insertion of the patellar tendon. It usually occurs in adolescent and pre-adolescent patients and frequently follows a rapid growth spurt. X-ray may show avulsion of the tubercle, but the femur is normal. Choice D. Patients with advanced hyperparathyroidism can develop increased resorption in cortical bone with subperiosteal thinning and cystic degeneration, or osteitis fibrosa cystica. Although X-ray may show lytic lesions, most patients have multifocal involvement, and either symptoms of hypercalcemia, example constipation, and fatigue in primary hyperparathyroidism, or a history of chronic renal failure in secondary hyperparathyroidism. Choice F. Osteoid osteoma is another benign bone tumor that appears on imaging as a small, round lucency. It typically causes nocturnal pain that is quickly relieved by non-steroidal anti-inflammatory medications, example ibuprofen. If you still don't understand, it might be beneficial to watch the next episode before you unintentionally cause harm to society.